We take in the previous video the uniaxial joints, which is hinge and pivot joints. Now in this video we will take the biaxial joints. What are the biaxial joints? The biaxial joints movement in two axes perpendicular to each other. First of all, we have condylar and bicondylar joints. In condylar or bicondylar joint, one convex articular surface, which is called condyle, like this. This is called condyle of the mandible, head of the mandible, like condyle, convex articular surface. This convex articular surface articulate with a concave articular surface. If there is one convex articular surface, one convex articular surface, this is called condylar joint. But if there are two convex articular surfaces, there are two condyles. Each condyle articulate with concave articular surface. In this case, this joint is called bicondylar joint. The movement in this joint is around a transverse axis. Transverse axis and vertical axis. We all know the transverse axis allow flexion and extension, and the vertical axis, around this vertical axis, allow medial and lateral rotation. The typical bicondylar joint is this: medial condyle and lateral condyles of femur articulate with the upper concave surface of tibia. This is bicondylar, and this joint between the head of the mandible or condyle of the mandible and the temporal bone. This joint is called temporomandibular joint. The joints, if condylar or bicondylar, allow movement around transverse axis, flexion and extension, and around a vertical axis allow medial and lateral rotation. There is another biaxial joint. Joint moves around two axes, called ellipsoid joint. The typical example of ellipsoid joint is the famous joint in this area, which is called the wrist joint. What happened in the wrist joint? How this ellipsoid joint is formed? Convexity of these bones. These small bones in the hand called carpal bones. The carpal bones form a convexity. These are the small bones, the carpal bones. The carpal bones here form a convexity. Sure, the convexity will articulate with a concavity, but the concavity here is elliptical concavity. Elliptical concavity. Elliptical means wide in the center and narrow in the periphery. This joint, which is typically occur in the wrist joint, allow movements in transverse direction, flexion and extension, and around an anteroposterior axis. Anteroposterior axis occur here, leading to adduction and abduction. We can do all movements together: flexion, abduction, extension, adduction. This is called the circumduction. These are the axes in the wrist. Anteroposterior axis allow abduction and adduction, and as usual the transverse axis allow flexion and extension. This is called ellipsoid. Why it is called ellipsoid? Due to the shape of the concavity. The shape of the concavity in the lower part of radius and the articular disc here below the ulna are elliptical in shape. Therefore, it's called ellipsoid joint. An example to the biaxial joint which allow movement in two axes are saddle joint. You know what is meant by saddle? Saddle like cowboy riding his horse. Why it is called saddle like the cowboy riding his horse? Because the two articular surfaces are concavo-convex, and the concavity of one articular surface fit with the convexity of the other articular surface. If you're riding the horse, please palpate yourself. You will find your area in contact with the saddle is concave from side to side and convex from anteroposterior, while the saddle is concave from anterior to posterior and convex from side to side. Against when you ride, you are concave from side to side and convex from anteroposterior. This is the typical joint which is saddle shape between this bone in the hand, called metacarpals. The joint between the first metacarpal, this is the first metacarpal of the thumb, articulate with the carpal bone. Therefore, the saddle joint is the metacarpal joint of the thumb, which is the big finger. Please look here. This is the articular surface of the carpal bone, and this is the articular surface of the first metacarpal. Concavo-convex articular surface, and the concavity of one fit with the convexity of the other. Here we open in this section the first carbo-metacarpal joint, and the concavity here fit with the convexity here, and the concavity here fit with the convexity on the opposite side. Because it is like a cowboy riding his horse, it is called the saddle joint. Therefore, the biaxial joints, there are three examples: condyloid, like knee and temporomandibular joint, and ellipsoid, which is the wrist joint, and the first carbo-metacarpal joint, which is saddle in shape. Then we reach the most movable joint all over the body, which move in 3 axes. Joints called the multi-axial joint. The multi-axial joint is formed of a convex articular surface, articulate with a concave articular surface. This shows the famous joint, which is the shoulder joint. This multi-axial joint like what? Like this rounded convex articular surface like a ball, and the concavity like a socket. Therefore, it is called ball and socket joints. Also, a famous ball and socket joint is the hip joint. This head of femur articulate with the head is rounded, articulate with a concavity in the hip bone, forming ball and socket joint called the hip joint. This is joints are freely mobile, and the most mobile joints all over the body moves in 3 axes. In the shoulder joint, these are the 3 axes. Axis from side to side means transverse axis, and usually the transverse axis is flexion and extension, and the axis vertically. The vertical axis is rotatory, rotation, medial and lateral rotation, and antero-posterior axis. Antero-posterior axis allow lateral movement away from the body, abduction, and the reverse, which is medial movement towards the middle line, which is called adduction. The antero-posterior axis allow abduction and adduction. This is called the multi-axial joint or ball and socket joint. Typical example, the 2 famous joints, shoulder and hip joints. Finally, there is no axial joint. What is the no axial joint? Plane joint. 2 fillet surfaces allow just gliding or sliding movement without any axis. The most famous is the joint between these small bones. We said before, these small bones in the wrist region are called the carpal bones. The carpal bones are 8 bones articulating together. Each joint with the other carpal bone is called the intercarpal joint, and allow only sliding or gliding movement without any axis. These are the types of joints. In the previous video, we take the uniaxial joint, which is axis transverse hinge or vertical axis pivot. We take in this video the biaxial joint, which is, remember, the knee and temporomandibular joint, which have condyles, therefore condylar or bicondylar joint. Remember the wrist, which has elliptical articular surface, ellipsoid joint. And remember the cowboy riding his horse, saddle joint. Then we take the polyaxial joint, ball and socket. And finally, sliding movement or gliding movement in no axial plane joints. Thank you for good listening and good luck. And always remember this fine table, which summarizes all types of joints along the axis. And this summary for hinge, pivot, condylar, ellipsoid, saddle, plain joint, and all types of joints are presenting here. Finally, please try to watch this video in the YouTube. It will be a summary for our speech in joints. Thank you for good listening and good luck.